Hi, this is Dr. Barnet Meltzer, your energy, wellness, and success coach. And today we're going to continue our discussion on how to overcome the coronavirus. Now, I want to make a very important point today, something that's been on my mind for a while. What I want people to understand is what's on trial, it's not about the virus. That's not what's on trial. What's on trial are two important things. Number one, the human race. Number two, what they call the health care or disease care system. So let me go over that carefully with you. What's on trial is the fact that human beings have to be willing to take accountability for their lifestyle choices. The federal government and the administrators in public health have this attitude that one size fits all, even though everybody's the same. And what's the truth of the matter is that we're all equal, but we're not all the same. But what's on trial is our ability to be well. What's on trial is our ability to take responsibility. That's what responsibility means, the ability to be responsive. You see, we're people to take responsibility for their thinking, for their lifestyle, for their choices, for their nutrition, for their exercise, for their relationships. Let's go back over it. The keys to wellness are metabolic power that comes from nutrition and exercise, mind power that comes from positive thinking, positive beliefs, soul power that comes from a deep connection to spirit, and emotional harmony. Those are the keys. What's on trial is that folks are not taking accountability for their lifestyle choices. Our culture, by and large, is overweight. By and large, is sedentary. People eat a large amount of inflammatory foods, from the wrong foods to coffee to sugar to alcohol. People have high stress. This is a new era now. We used to be in the era of technology. The years before that, we were in the era of medication. Well, right now, we're coming into the era of accelerated aging and accelerated anxiety. Where are people taking accountability for their choices? Where are people taking responsibility for their health? I remember hearing the Surgeon General say, "We're going to keep you safe. The government's going to keep you safe." That's way out. That's way inaccurate. Very deceptive. You have the responsibility to keep yourself well. You have the responsibility to make your life choices, not the government. So the first thing that's on trial is the human race willing to take accountability for not being in an anti-inflammatory lifestyle. When patients come to see me, I always ask them three questions. Who's causing your condition? So, for example, let's say they have arthritis. Who's causing your arthritis? What could be causing your arthritis? And what's the benefit? So let's look at the virus situation. Who's causing the virus when people get infected? Well, the only person that creates your success is yourself. And the only person that causes illness is yourself. What's causing it is high levels of inflammation. What's the benefit? It's a feedback loop to the universe. It's a feedback loop. It's a wake-up call to the human race that we have to shift to a value of health. We have to be focused on wellness, taking charge of ourselves and our loved ones in terms of being sure we all stay healthy through exercise and the proper nutrition and the right attitudes. That's what's on trial. And the second thing that's on trial is our disease care system. We're not empowering people to be well. The disease care system is based on intervention. It's up to them to keep you well. No, it's up to us to keep ourselves well. Yes, we need the government to help in certain times when we hit a pandemic, to help slow down the velocity, but it's not up to them to keep us well. So the two things that are on trial that have to shift is one, the human race has to take more awareness, become more conscious, be more accountable for their choices and stop blaming it on a virus or on China or on some country. And number two, the healthcare delivery system has to focus on prevention. The best way to treat a problem is prevent it. Remember this, the least costly illness is one that never occurs. The healthcare delivery system is focusing on disease. It doesn't focus on empowerment. So that's what's on trial. So what do I want to see happen? I want to see people take responsibility for their health, and I want to see our disease care delivery system become a healthcare delivery system where we educate and guide and motivate people to be well, and we educate to prevent disease. That's what I think is on trial.